Okay, so I'm going to show you how to do a heart and lung auscultation. The first thing you want to do is you want to get your stethoscope, and you want to have the earbuds in your ear facing towards your nose, and you want to locate the heart. Now the first thing to do about locating the heart is look for the diaphragm, and it's going to be behind the left elbow. So I would come underneath, and just behind that elbow I've located the heart. Now at this point is where I would go ahead and I'll take the rate. Okay, so what I tend to do is I ended up counting beats per 6 seconds and then timesing it by 10, which would give you 60 seconds and however much within that time frame. So for him, I counted 11, so times it by 10, which means his heart rate would be 110. And you also want to confirm the heart rate with the femoral pulse. So what you would do at that time is you would go ahead and you would take 3 fingers and place it behind the stifle, and you'll locate it. And there I have located it. So now I'm about to make sure that the same rate applies. Okay, so yes, it is the same. Now you also want to make sure that it has the same intensity as the heart rate, at the diaphragm, and then you also want to make sure that it matches the other femoral pulse, matching intensity and frequency. And it does. Okay, so now you also want to make sure when you are auscultating the heart, not only do you want to get a heart rate, but you also want to evaluate the heartbeat, such as the rhythm, and if there's any squishes between the heartbeats. If so, that might indicate a heart murmur, and you definitely want to report that to the doctor. And then the rhythm should be regular, and each beat should be separated by equal time intervals. Okay. So now it's time for the lung auscultation, and what you want to do is you want to make sure your stethoscope earbuds are in the same way as if you were going to get the heart rate. It should always be in that manner with the earbuds facing your nose. But then you want to locate the lungs, and the first thing you want to do is evaluate the breathing, the respiratory rate at the trachea. Okay, so I do hear it. Everything sounds fine to me. But now you want to move to the actual lungs, and there's like 9 quadrants. So you want to listen to all quadrants and listen on both sides. Okay, so upon listening, I wasn't able to hear any crackles or wheezing or anything that could indicate pulmonary edema or pleural infusion. But then you also want to get the the respiratory rate in the same manner that you got your heart rate. So what I'm going to do again is I'm going to listen to the lungs, and I'm going to count how many beats per 6 seconds and then times that by 10 to get my respiratory rate. So I got 6 breaths in a 6-second period, and you will time that by 10, so that would mean it was 60. So the heart rate was 110, and the respiratory rate was 60. If there's anything that you might not know about, or you might be iffy or concerned, just go ahead and notify a doctor. Hi, now I'm going to show you or demonstrate conducting an ECG, the ECG essentially just measures the heart rate, the rhythm, the waveform, and intervals, and assess the vertical rate, the vertical waves of the impulse in millivolts, and horizontal waves in time and seconds. So what we're going to do first is we're going to go ahead and attach the leads. We have multiple ways of attaching the leads and remembering which leads go on what. For instance, one of our technicians here does black and white means newspaper, and you get it on the front porch, and red and green is Christmas colors, and that at the end of the year. So, but they also have the initials on there. Right arm and left arm.
This way, but yeah.
And you're going to go ahead and place it a little, above the stifle.
What'd she say?
I know, that don't feel good. And I'm going to go ahead and apply a little bit of the alcohol.
Tequila.
All right, and we're going to do the same thing to the stifle. Okay, so we have the black on the left arm, the white on the right arm, the green on the right leg, and the red on the left leg. We've added alcohol to each of the leads, and what that does actually is it minimizes respiratory artifacts. And now we're going to go ahead and turn on our ECG and wait for it to register the sensors and evaluate each wave. And they would like for you to keep still and quiet so the patient doesn't move during this recording.
I didn't say that.
I mean, I do that sometimes just
Okay. So now that we got that, we're going to go ahead and I'm going to take off the leads, and then we're going to go ahead and assess the report. Give me 1 second. Okay, so now we're going to go ahead and assess the readings from the ECG. Okay, so the first wave is going to be the P wave, which is, let's say from this one right here, it's going to be this. This is the P wave. I don't know if you can see it. That's the P wave. And then there's the Q wave, which is going to be the bottom. I like to call it the valley. And then you're going to go into the R, which is going to be the peak, and it's the highest one. And the one right after that is the S. So those are all the waves. And if you want to monitor for any irregularities or changes in frequency. Now, if the P and the T wave are irregular, you want to always notify a doctor. If there's supraventricular in origin of the sinus node or the aorta or the AV node, it can be non-ventricular and have ventricular impulse without regular rhythm, which will show erratic and wide QRS complex. If the P wave has a QRS complex, then it shows a sinus arrhythmia. If it has a Q wave for every P wave, then it has a sinus arrhythmia. If there's no to either one of those, then it's not an arrhythmia. make sure the rhythm is regular, and if it isn't regular, see if it's regularly irregular. If you hear premature beats, that can indicate a fibrillation, as well as irregular rhythm. Okay, just to recap. I wonder if I can, let me see. Okay. So the P wave would be like right here. Q, the bottom. R, the top. And S, down here. So those are the waves. Okay, thank you. Hi, so I'm going to show you how to use a rabies pole. Now, you don't necessarily have to do it on a aggressive pet, but you do have to be concerned about injury to the staff or to the patient. If that's a concern, then you might want to go ahead and use the rabies pole. Now, as you can see, this is the noose, and this is the pole part, which we have the handles. Now, to extend the noose further out, to make it a little bit wider, you're going to pull back on this black piece right here at the top of the handle, and you can just extend it that way. Now that we have it extended, we're going to go ahead and use our noose and slip it right over the patient's head. Oh, good boy. And then to tighten it, you're just going to pull back on the wire cord. And then when it's tightened a little snug, but not too snug, you'll go ahead and then you'll lead them around with the pole. All right. Good boy. All right. Now that we're at a safe distance, and say we have him back in his kennel or run, we're going to want to release him. Now, this little key lever thing is going to open up, and the snap part of the catch pole or the rabies pole is going to be released. All right. All right. Well, that's it. Thank you. Hi, I'm going to go ahead and show you how to do a free catch urine sample. Now, the main things you're going to want to use is gloves in cases of zoonotic disease such as leptospirosis, and you want to have at least a 6 cc syringe and a ladle. You can also use like a bowl or a tray or anything like that. And the one thing that I want to pinpoint is that you always want to get your sample midstream. That way it kind of limits the bacteria that can come into your sample. All right, if you're ready, let's see how he goes. Come on. Come on, buddy. See, midstream. All right, so now what I'll do with my 6 cc syringe, I'll draw up all that the syringe can take. All right, and that's really all we need just for a UA. So you're gonna just dump the rest and then take this back and run your samples. All right, thank you. Hi, so I'm going to show you how to disinfect and clean a kennel cage. First thing you want to do is get you a, you can get a paper towel or you can get a cloth, and you're going to want to get your disinfectant. Here we use trifectant, and trifectant has a kill time of 10 minutes. So what you typically are going to do, you're going to open the cage and you're going to spray all the sides of it and the top, all the sides of the cage, the top, the bottom, the door, and the other side of the door, and the little panels and edges right here. All right. I'll be back in 10 minutes. Okay, so it's been 10 minutes, so now we're going to go ahead and we're going to wipe everything down. What you want to do is you want to start at the top, and then you're going to want to do the sides, then the back, and then you're going to do the bottom, which is going to be last. Then you're going to go around and do the edges or the panels, and then you're going to do the door and the other side of the door. Alright, so this is how it goes. And then the bottom. Now, sometimes you can go ahead and do your kill time, which is for us 10 minutes, but a lot of people like to also spray after the fact, just to ensure that it is actually, disinfected.
Uh-oh. Did I mess it up?
No, it's fine.
You have to do it on cleaning or...
Now, some of these doors like these are actually removable. So say like if you need it, if it's like completely dirty or you can, it's just gonna be a big hassle to kind of wipe down. You can always go and remove the door and hose it down in the kennel area. Only thing is you're gonna have to disinfect it again afterwards. So that's it. Thank you. Hi, my name is Marie, and I'm going to show you how to do a urinary catheter on a male dog. So first thing, you're going to go ahead and open up the doctor's glove. Be careful not to touch the inside because this is going to be your sterile field. So let's show you how I do this. Okay. So okay, so then you're going to go ahead and get your sterile lube, and you're going to place it in the corner. So I'm going to put it right here. Okay, and then you have your 6cc syringe, and I'm going to drop that in the sterile field as well. Okay, and then we have our okay, so now I have my number 5 red rubber feeding catheter, and what I'm going to do is I'm going to open it part way, just enough so that the doctor can go ahead and pull it out of the package and it still be sterile. And then I place it right there. Okay, so as you can see, it's all in the sterile field, nothing has been touched. So now we can go ahead and start to scrub the prepuce. And you're going to do it with the chlorhexidine solution. lying down. Sorry. Good boy. Okay. So now my doctor's here. She's going to go ahead and get ready. Now she's putting it through the lube, the sterile lube, basically lubricating the red rubber catheter for placement. Okay, so now I'm going to expose.
So you can try putting your hand further behind the penis and kind of push it forward.
Okay. Now it is exposed. She's going to go ahead and start placement. And she's going to do it slowly.
Ooh, I've had to pee for a while.
Today.
Oh, I won't see you till Monday.
Take on.
It's okay.
Good boy, Nikki.
I know you can.
Okay. Once she feels like she has a good placement, she's going to go ahead and attach the syringe to the end of the catheter and pull back on the plunger. And she does get good flow. If you don't get good flow, then you want to go ahead and adjust and try to replace it. Now that we've gotten the sample, she's going to slowly pull out the catheter. And if you wanted to get this sample and put it in a tube, you'll want to go ahead and remove the catheter and put a fresh needle on the syringe and place it into a sterile tube. All right, thank you. Hi, I'm going to go ahead and go over about getting a cysto. Now, a cysto is collecting urine using the ultrasound with the needle through the abdomen. Let me make sure she's okay. Okay. Now what you're going to do is apply alcohol, and with girl dogs especially, it will pull in the area of where the bladder would be, and then you use your ultrasound to locate the bladder. Okay, she has located the bladder, and she will advance the needle into the abdomen. All right. You can add one there. Okay. Now she pulls back on the plunger, and then you retrieve your sample. Now, what you would do now, in case you wanted to send off the sample or put it in a tube, you'll replace the needle and then do it that way. All right. Thank you. Okay, so I'm going to show you how to do ocular testing. In this video, it's going to be the Schwimmer tear test. And what that does is it basically measures the tear production in the eyes. And what you're going to want to do is you're going to want to bend the corner before opening. Okay, so it is bent. Now I'm going to open it. Okay. And it's going to go in the middle of the eyelid. Okay. You're going to part the eyes, stick the strip underneath, and hold for 1 minute. Now, they will probably try to move and, you know, blink and everything like that. So just hold the eyes shut and keep them as still as possible. Okay. So it's showing like about a 7 or 8, and anything less than 15 is normal, but 10 to 15 is borderline dry eye or KCS, and that's for the Schwimmer tear test. Okay, so now we're going to go over the tonometer and tonometry. So what you would typically do is you're going to want to numb the eye with either tetracaine or proparacaine, and you're just going to add a drop to each of the eyes. And let that wait for about a minute. And let that wait for a few minutes. Now I'm going to go over the old tonometer, and because we have a different one here. We have a new one that we exclusively use and the only one we use. But on the old one, you would go ahead, and it's like, I think, a tonometer pin, and you're going to have a tonometer pin, and then you're going to have an applicator that you'll apply to the pin by slipping it over the top. And then you're going to calibrate it, which I believe how we used to do it was we'll hit the button like 2 times or hold it down, and then when it beeps, it will let you know that it's ready to go. But for ours, actually, we have this, and it's the eye care tomonovet. And what you'll do is after the eye's been numb, which we still have a few minutes, that you would go ahead and apply one of these into the thermometer. Now we just did that, and this is what it looks like. Okay, so now we're going to apply the alright, so now we're going to apply it. We're just going to slip it into the hole. There it is. I'm pretty sure you can barely see it. But now that it's in, we're going to go ahead and turn it on. Alright, so now it's coming on, and you don't really have to calibrate it or anything like that. What you're able to do is, because it's not one of the old tonometers, a doctor would normally do the old tonometers, but this one's kind of newer, so we can do it as a tech without involving a doctor. Alright, so it says measure, and now it's saying it's ready to go. So my restrainer is going to hold the head steady. It's not going to be too high because I can get false elevation results. I'm going to spread the eye, and I'm going to get close to the eye. And you see how it turns green and red? When it's green, it's a go. When it's red, then you need to adjust. So it's saying right now that it's too far. Okay. So I'm going to get a little closer. Alright, now that one read 31. Okay. Any values underneath the, let's say 20 mark would indicate glaucoma. Alright, And another thing, on the ultratometer, you would manually tap, but with this one, it actually pulses or taps it for you, so that way you're not doing any kind of harmfulness. All right. Okay, so we're gonna do the fluorescence eye stain test. Now you're going to, here's our fluorescent sodium strip, and you'll peel here. Remove from package. You're going to add saline, right here. You're going to put a couple drops on the tip of the strip. Okay. And then you're going to lightly touch the eye with it. Oops, no. Little girl. There we go. Okay. Okay. So now that we're done with the strip, we're going to flush the eye. I have my gauze underneath the eye so that way any of the stain doesn't really stain the rest of her hair or her coat. And as you can see, it comes out like a neon yellow. Okay. Let's see. Do one more flush since she's. Okay. There we go. All right. Now, if there's any kind of scratch or ulcer on the eye or the cornea, it's going to show up. It's going to kind of glow. And you can use a light source. Here we use this flashlight with the purple. And as you can see, the eye is actually glowing. Here, let me put it right here. And as you can see, the eye is glowing, but I don't see any scratches or ulcers within the eye. All right. So now that we've done and we found no ulcer or no scratch to the eye or the cornea, we're going to go ahead and flush the eye and get the remaining stain out. All right, thank you. Hi, so now I'm going to show you how to do an anal sac expression. First things, you want to have your gloves because you don't want to do it without them. You also have a paper towel just to catch it in case it kind of squirts out. And then you also have your loop. So the next thing you want to do is you're going to want to go ahead and lift the tail and stick your finger into the rectum. And then once it's in the rectum, the anal sacs are located at like 4 and 8 o'clock. And then what you're going to do is you're going to kind of squeeze on it, but you're going to kind of squeeze it in a way like you would pop a pimple, kind of. The sacs actually feel like little marbles, and when you locate them, then you'll kind of squeeze or milk out the substance inside. So, here we go. All right. Yeah, that's good, girl. That's good, girl. All right, one gland down. Other to go. Okay, so hers was really full. As you can see, this is the substance. Thin, not chunky or anything like that, so that's good. Seems all normal. Only thing left to do is to go ahead and clean her up a bit. So a lot of people just use water. That tends not to excuse the smell, and if you've ever smelled anal glands, you know it's like horrendous and it lingers. So the ear flush actually creates kind of like an older barrier, and because of the nature of the anal glands procedure, you don't really want to rub the area, the rectum area. You want to just like kind of wipe, and not an aggressive wipe at that. So now that we've kind of wiped her down and cleaned her up a bit, the next thing is to use this Groomate spray, and it's just going to be like a deodorizing spray. All right, what a good girl. Thank you. Okay, so now I'm going to show you how to give an enema administration. First thing is that you want to have a bowl of lukewarm water and some soap. And then you also want to make sure you have at least a 25 ml syringe. We have here a 35 ml, so that's what we're going to use. And then you also want to go ahead and have your red rubber catheter and a paper towel with lube. Oops, excuse me. So, I'm going to apply the lube to the paper towel. Okay, I'm going to open up part way the the red rubber catheter part way, so that way the doctor is able to pull it out. Okay. And then actually my doctor feels like, you know, a 60 ml would be more appropriate for this case, so that's what we're going to do. I went ahead and broke the seal so that way, and took off the top, so that way she's able to get to it in a more sterile manner. Okay. Okay. So now she's going to go ahead and lubricate about 1/4 of the catheter. All right. And now she's inserting the catheter into the rectum. She's going to then attach the syringe. To the red rubber catheter. That's filled with the lukewarm and soap water. And she's going to attach it and slowly advance the catheter and administer the enema, all the enema. Now, because this pet doesn't necessarily need it, we're not going to actually administer it. But what you would do is you will go ahead and try to do all of the enema. If you met resistance, you need to readjust the catheter by pulling out and in until it goes in smoothly. And then for like a dog, you want to do 120 mils like a big dog, but then you're going to take out, put the patient back in the cage, and hopefully they will defecate. If they do not defecate, then you're going to want to retry and redo the enema within another hour. All right, thank you.
A little dangerous.
Okay, so now I'm going to show you how to apply a topical medication. This here is T-Bird, and T-Bird's going to get a revolution. So I just take it out of the package and I go ahead and click it down, take the cap off, and now I'm going to go ahead and separate the hair and make a little part. And you want to do it at the base of the head. You don't want to do it behind this, a little over these scapulas or the shoulders, just because they can turn around and get to that area and lick themselves there. So you want to do it really at the base of the head. And you just squeeze. All right, it's empty. And now what I typically do is I just massage it into that part. And it's really good to have gloves on, because you don't want that medication on you and you forget and rub your eye or something. All right, so that's it. Thank you. Okay, hi, I'm going to show you how to clean the ears of a dog. Now, what you're going to need first is your ear flush, a little bit of gauze, some cotton balls, and some cotton swabs. And you're going to want to, for a dog, kind of lift the ear by the pinna, which extends the canal. You can put a little few squirts in there, and then we'll massage at the base so that way you get some of the wax and debris lifted off the ear. And then what you can do for your first few wipes, you can go ahead and do the gauze. That way it's not so abrasive. Just a few wipes, no scrubbing or rubbing. Just a few wipes, just to get all that excess out from around the ear. And then you can use a cotton ball for actually down in the ear canal. But make sure you don't lose it. I know. And then for deeper down the ear canal, you can use some cotton swabs. Okay? There we go. All right, so now let me show you how to give some medications. This is Post-X, and you can take the cap off, and typically what you're doing, you're going to, same thing, lift the ear by the pinna, stick it directly down the canal, and give it a few squeezes, maybe 3 or 5, and then when you're done, you massage it. All right, so that's it. Thank you. Alright, so now I'm going to show you how to clean a cat's ears. Normally with the dog, you would take the ear flush and you can pour it directly into the ear canal. With cats, you tend not to be able to do that. It could create problems, serious problems in fact, even like vestibular and stuff like that. It probably has a problem with their eardrum, and it just can create a lot of problems. So what you do is you have your ear flush. I put it a little bit on the gauze. And then I put it on like 2, maybe 3, depending on the size of the cat, cotton balls. And then I wet some Q-tips. I have 4. I shouldn't need that much, but it's best just to have some just in case. Now what I typically do for the pinna is I take the gauze and I kind of gently try to remove some of the superficial wax and debris. All right, so I did that, and the pinna and the outer part of the ear looks pretty good. So now I'm going to take one of my moistened cotton balls, and I'm going to go kind of a little deeper. Okay, then I'm going to take a dry one just to get a little bit of that moisture out. And massage the base of the ear while I do it. Okay. And I kind of did towards the front, so now I'm going to do towards the back. Okay, got a little bit more. So now I'm going to take a Q-tip, and I'm going to go into the crevices just to remove any of that superficial. And his ear seems to be real itchy. Okay, now I'm going to get one more Q-tip. Go slightly deeper, but not too deep. You don't want to go far. I know, it's itchy ear. Okay. All right. So now that we have cleaned the ear, I always take another dry cotton ball and massage it in just to get the rest of that moisture out. Good time to massage it and get that itch going. Oh yeah, okay. All right, so that is it. Thank you. Hi, so I actually forgot to medicate T-Bird's ears, so I'm gonna go ahead and do that now. So what we're gonna do is we're gonna apply the Post-X, and you're just gonna stick it. You're gonna stick the ear up. You're going to extend the ear canal and stick it down. Now we're going to squeeze this 5 times. And then we're going to massage it. Oh. Now again, just like Q-tips, you never want to stick it too far down. That'll mess with your eardrums, but you do want it enough further down so that way the ear is completely being medicated and treated. Okay, thank you. Hi, I'm going to show you how to give subcutaneous or sub-Q fluids first, always, you're going to want to go ahead and switch the needle on the line to a fresh needle. We prefer 18 gauge. It just, the bigger the needle, the better, just to get the flow in. And then you're going to want to go ahead and go kind of for the scapulus area, or the area between the shoulder blades. You're going to want to tip the skin with your first finger, middle finger, and your thumb behind. With the bevel up, and you're going to go right underneath the skin.
Come on, shake your head.
All right. So with one hand, I'm going to keep that in place. Second hand, I'm going to go ahead and unclamp the line. All right. If you can see there's dripping right here, that means that it is flowing. And then you also want to make sure that there's not any leakage. Sometimes the sensation could be a little bit unpleasant or surprising, so they'll move a little bit. But all right. So now that we have gotten fluids, we are going to go for a little bit more. There are different apparatuses like this. Infuse that, it goes over the bag, and you pump it up and apply pressure to the bag to get the flow to go even more rapid. You can apply pressure manually with your hands, or you can just let it drip itself. So we gotta go for a few, so I'm gonna speed this up. Hold on 1 second.
Okay, Baba, let me put this shit in your mouth.
Alright, so now we've gotten the amount of fluids we need, so we're gonna go ahead and remove the needle. And then I'm also going to apply pressure with some gauze at the site of puncture. And then also what I'm going to do is now I'm going to switch the needle again. Just that way to make sure that you are not cross-referencing or you're never getting a dirty needle. Alright, so that is it. Thank you. My name is Marie, and or Blankita Marie Francis, and I'm going to show you how to form a toenail trim on a dog. So I have my trimmers right here, and just in case I push them, I also have my quick stop. So what you're going to want to do is you're going to want to apply pressure on the pads at the feet, so that way it kind of exposes the nail. And since this cutie has brown feet, he also has brown nails. So it's going to be kind of hard to see where to cut without quickening them. So if you notice on the nails, there's this one like peak or curve in the nails that naturally allows for you to cut it without quicking them. So you're just going to do trims, and you're going to kind of want to look for like the little black dot. I know, we just got one more toe.
You're okay, pup.
You're okay, buddy. 1, 2, 3. All right, and that's how you conduct a toenail trim. Thank you. Hi, my name is Marie, or Blankita Marie Francis, and I'm going to go over how to trim a cat's nails. This here's Lila. She's here boarding, and you can use these are the standard toenail trimmers, which I normally do for dogs, but there are smaller trimmers that seem to work very well with cats. And you can get a towel and wrap and like burrito wrap if you're worried about them moving, or if you're thinking that they might be a little bit agitated with getting the nail trim. And then you also want to get your quick stop, just in case you do quick the nail. The one thing I would like to say, well, the advice I would like to give is you never really want to quick a cat. Dogs, sometimes it does happen, but you never really want to quick a cat. Because they're more than likely not going to be too happy about it. Okay, so move this a little bit. Okay. Hi, Lila. Hi, Lila. Hi. Okay, so what you want to do is when you look for the nail, you want to press on the digit and kind of expose the nail. Now, she has clear nails or white nails, and you can kind of see the pink of the quick right there. So it lets you know not to go further than that. And the nails also have a natural arch, so if you go and there's a natural part that the trimmers seem to stick to the nail, then normally that's going to be the best part to start. And then you always want to go ahead and check the dew claws, make sure that they don't have any nails. And dew claws tend to be one of the sharpest. And then you also want to check the rest of the foot, because with cats they can have extra digits and be what's called a polydactyl. And that just means they have extra digits. All right. Now you're going to also want to inform the doctor if you see anything weird with the nails, such as if there's just like fungus or any kind of bleeding or irritation at the nail bed. Also, if the nails actually grow into the pads of the feet, if they outgrow, and they'll tend to curl in and kind of embed themselves in the skin, which can cause sores and bleeding once you trim the nail or remove it from the pad. And that should definitely be brought up to a doctor so they can evaluate it, see if there's anything that needs to be given as far as antibiotics or pain medications. All right, I think that's it. Thank you. Hi, so I'm going to show you how to do an emergency bandage on a patient. Now, if it's going to be like a laceration, you're going to apply the emergency bandage until a doctor is able to come and assess the wounds. You're going to wear gloves to minimize any kind of contamination or germs or debris into the actual wound. And you're going to want to hold on top of the wound the Teflon pad and a little stack of gauze. So let's say it's over her abdomen. Teflon pad will come here and the gauze will go on top of it. Now you're going to want to go ahead and use vet wrap to keep the bandage in place until the doctor is able to come assess it. Now, vet wrap is real clinging and becomes real tight. So what we tend to do is we unravel it and then ravel it back up, so that way it kind of loosens and it doesn't become too tight or stitched onto the area. So what you'll do is you'll go, let's say top, tight, and then under, you would just go lightly. Not tight, but not too loose. Top, tight, loose, under. Now, in this case, you would like to always try to leave a courtesy tab for the next person who's going to be taking the bandage off. All right. And you want to be sure just you want to have it as tight as possible to stop the bleeding or decrease the bleeding, but you want to have it without too much pressure on the organs, the internal organs, and compromise those organs. All right, so then you rip the end of the vet wrap, leave your courtesy tab, and that's it. Thank you. All right, so now I'm going to show you how to do a modified Robert Jones bandage. And the first thing that you want to do is get the material out. So we have here our stirrups that I've already placed on there. Now, a lot of people use a tongue depressor in between, and that's the way they peel it back and rotate it onto the bandage. But what I tend to do is I just make a little tab at the end, so that way it's just easier to peel and quicker. I don't have to use another utensil when I don't need it. So we have our vet wrap, which is what we'll save for last. We have our cling, or the conform, which is what we'll use before we use the vet wrap. And then we have our cast padding. And that's what we're going to use primarily for the bandage. It's just for the padding to make sure that everything stays in and no damage, protects the incision site, things like that. And essentially the modified Robert Jones bandage is applied for like temporary compression of a limb after surgery, and then functions to protect the incision site, like I said. It also decreases swelling that aids in healing. So you're going to go ahead and apply your stirrups 1/3 of the limb, overlapping the toes like we have here. And then we also have a courtesy tab. Like I said, we have our courtesy tab. Some people use the tongue depressors, and that's perfectly fine, but here we do the courtesy tab. And then, and that's really just for easy removal. I can just peel it back and go, instead of just, you know, unsticking it and stuff. Now, you want to wrap lightly with your cast padding. You're going to start at the toes, but remember, you want to leave the toes visible just to be able to check for swelling and, for the most part, just the swelling. And then, after you leave the toes, let's say the middle 2 toes, you're going to go ahead and wrap lightly around the foot. And when you're wrapping, you want to do like half on, half off, which essentially means that you are wrapping, and as you wrap, you're covering 50% of the previous round of wrap that went before it. Okay. Oh, and another thing, you want to work your way distally to, you want to work your way from the end of the foot and move it more close to proximal. That means closer to the body. And you want to try not to have any wrinkles or creases. Try to get it straight and even. There we go. And then with the cast padding, you want to have 2 layers. So now after you went as far as you need to go, you're going to actually go back down and you're going to do the same thing, half on, half off. And you don't want to do it too tight. You do want it a little snug, but not too tight. Kind of do it lightly, but enough to actually apply pressure to keep anything from bleeding and protect the wound or incision site. Alright, so that's it for the cast padding. Now we're going to use the cling or the conform. And you're essentially going to do the same thing. You're going to go ahead and, you're going to, actually with the cling or the conform, you're going to wrap a little tighter than what you did with the cast padding. And again, you're going to start at the end and move yourself proximal. Half on, half off. And then with the cling, the only difference is, well, besides it being tighter, the only other difference is between the cling and the cast padding is that you don't necessarily need to get 2 layers of the cling. No. Just enough to keep it tight and still. And now we're going to go ahead and separate our stirrups. And then once you have them separated, you're going to rotate the tape in. Okay, I'm going to rotate this way. Okay. Good girl. And then you're going to vet wrap. Now, when you do the vet wrap, you're going to leave the toes out again. You're not going to want it directly on the skin. It causes irritation if you do that. And you're going to want it to be tight, but not too tight. And what we do typically to make sure it's not as tight or cinched up is that you unravel it and then you roll it back up. So that way it's kind of stretched and it's not so cinched and it doesn't over tighten on the bandage. And it's the same thing. You're going to want to go ahead and leave the toes visible. And you want to go tight over and let's say loose or lightly under. Okay, so like I was saying, you're going to want to go tightly underneath, lightly over. Make sure there's no creases or wrinkles. And then you're going to work yourself down. Again, don't get it directly on the skin, like I almost just did. All right. All right, we're basically done. All I'm going to do is leave a courtesy tab for the person who's going to be taking off the bandage, and which will be me. So we'll show you now how to remove the bandage. Now here's a courtesy tab. So we're just going to unravel the vet wrap. If for any reason they did not leave a courtesy tab and you're not able to unravel it on your own, you can always use bandage scissors. And just be real careful because there have been, cases where people accidentally cut the pet when removing bandages. So that's why I like to unravel than other cut. And you're going to want to go ahead and when you do cut it, you want to go from either the top or the bottom. You can do top and bottom and just see how far you can go without cutting the pet. You can put alcohol on it, that might help separate the skin from it. Other than that, you're just going to slowly take it apart and remove the case padding, remove the cling or the ecoform. And then you're going to pull back the stirrups and just take them off. And just so you can see what I'm talking about as far as removing the bandage, you can come from this side. And a lot of times you want to angle and shake it and make sure it's not too tight. Make sure you're not on the skin. I sometimes put my finger underneath and cut. Just to make sure there's a little leverage. And do it slowly, just to ensure that you're not, cutting the patient. And then at this time, I would like to tear it. Alright, so now that's gotten pretty low to where now I kind of feel more comfortable cutting. Okay, and then you remove it, you would assess the wound or the incision site, and everything looks pretty good to me. There is no swelling. If any of that does not look normal or there is swelling or it has an odor, notify a doctor. Alright, thank you. Okay, hi. I'm going to show you how to do a dental x-ray. First, you want to have your patient in a sternal position, and you're going to want to keep the pet with their head kind of angled down a little bit like this one, but you also have to have it supported. So we're going to go ahead and insert the plate, and we're going to do it with the flat side up. And there's a number of ways that you can actually support the plate. Right now we're using a paper towel. And I'm going to slip it in between the canines and almost have the inside just coming to the end of the plate. Okay? And then we're going to do the x-ray.
Unless you want to just...
And then sometimes your
Go. Yeah.
it says kind of go straight down, but we had noticed that we had calculated the right angle using the bisecting technique. So, is that right? That looks good. I'm gonna go ahead and step out the way. And always make sure you have on your protective gear. And I'm gonna step out the way and take the x-ray. Oh. Okay. There. All right. Now that looks better. Alright. So sorry, for some reason my trigger, arm controller right here didn't really register it, so I had to pull my arm and actually do it right here. But let me show you the x-ray. Okay, as you can see, there is a shot of the incisor that I just took. All right, thank you. Okay, I'm going to show you now how to do a dental procedure. The first thing is going to be the hand scaling, and you're going to want to, with the hand scale, you're going to want to scrape off any other tartar that you see, and you don't want to go too close to the gingiva. You're going to go all around the tooth. And I will show you how. All right, so we're gonna do the canine, and you're gonna take the edge and you're just gonna scrape off the basic, but don't get too close to the gingiva or the gums. You know what I mean? And you're gonna do all around the tooth. Okay, and for the sake of the video, I'm just going to do one tooth. Seems like May here isn't too bad. So I got quite a bit off. And now we're going to do the ultrasonic scaler. Now with the ultrasonic scaler, you're not going to want to touch the tooth directly. It's also going to produce a decent amount of water. And you're just going to simply glide over the tooth, and for about like 10 to 15 seconds. Alright, that's it for that tooth. And now it's going to be the polish. And we have here our Profi paste. Oh, thank you. Alright, now we're going to add the paste to our polisher, and one thing you want to remember is you're not going to want to go in circles because it already does that for you. You're going to press down lightly, and then you're going to go a little moderately but not too hard, and it's going to be all along the tooth, and it's just going to be a couple of seconds, and then you're going to move on. Oh, here, let me show you. Okay. All right, so that's it. Thank you. Okay, so now I'm going to demonstrate how to discharge a patient from a dental procedure. Hi, Ms. Holmes. How are you doing today?
I'm well, Marie. Thank you.
Good. Now, before us really releasing Bradley to you, I just want to go over a few instructions and a few things for aftercare take-home instructions. Okay. So we did put him under anesthesia today. Before doing that, we did check his blood. We did blood work as a comprehensive blood count, which evaluates the red blood cells and the white blood cells. And then we did a chemistry, which would evaluate certain organs and the enzymes to make sure that they are functioning properly. and both of them were good. So that told us that we should be able to go ahead with the procedure. Now, because he was under anesthesia, we were able to extract a few of his molars. And because he's on anesthesia, he might be a little groggy or hazy when going home. You just want to try to keep quiet and maybe restrict their activity. They should be feeling better by tomorrow. You just have to watch and let us know how it goes. If they are not all the way back by tomorrow, then just give us a call and we can figure it out. Okay, so also because of the extractions, you would probably have to wet his food. You can add water to his kibble, or you can provide canned food. You want to avoid any hard items like bones or toys or even raw hides because they're so strong in the material that it could really aggravate those extraction sites and cause a little bit more problems as far as chewing goes. And we're going to go ahead and send you home with some medications. The medications we're going to send home is Novox. The generic name is Carprofen. And it's an NSAID and a kind of pain and anti-inflammatory medication. You're going to want to give 1 tablet by the mouth once a day until gone. And we have them scheduled for 14 days. And at the end of that, we'll come back in and we will assess the incision sites from the extractions just to make sure they are healing appropriately. Now, as far as tonight, the meals you're going to go ahead and give is going to be 1/2 to 1/3 of the normal meal you would give. And that's just to make sure that we don't strain the gastrointestinal system and give them a little GI or gastrointestinal upset. And what we have here is some samples of preventative oral care, and we have put some together as a sample for you to take home. We have a toothbrush here, and then we also have enzymatic toothpaste, which helps break down the plaque and tartar of the teeth. And we also have this TD product, which is Hill's Prescription Diet. It is used as a kibble primarily, but also can be used as treats. It tends to be received very well by the patients and minimizes plaque and tartar. There are also chews available. They help reduce plaque and tartar buildup as well. All these products reduce and minimizes the accumulation of plaque and tartar of healthy gums, but don't replace the dental procedures. But it can minimize how often you have dentals and how soon they are conducted or performed. If there are any complications, you can give us a call. If you have any questions, go ahead and give us a call, contact us. Our number is listed at on your invoice, and the emergency hospital, should something occur after hours, is going to be left on our telephone recording system. So is there anything you have questions of?
Those treats you mentioned, am I to wait on giving those until after the mouth is healed?
You are. So for the treats, again, it goes with the 2-week period. You don't want to give anything hard for those 2 weeks. So those will be held off until after we check the incision sites.
Very good, thank you.
You're welcome.